Hi, and welcome to this narrated PowerPoint on working short-staffed or work in a shift that you believe has inadequate or unsafe staffing. My name is Pat Clay. I have a master's degree in nursing. I'm a registered nurse, and I currently have pediatric nurse certification, and I'm certified in wound and ostomy care. I worked as a direct care nurse, manager, and clinical instructor. You can find more narrated PowerPoints for nursing students and others on my YouTube channel at Prof. Clay A+ Clinicals. More about that on the last slide. It's important to keep these three goals in mind if you're facing a shift that is short-staffed. Protect your patients, protect yourself, and protect your organization. There are a few things that should or do inform nurse staffing. Nurse-to-patient ratios, the acuity levels of the patients, and skill mix. The Code of Federal Regulations outlines what's needed by organizations to participate in Medicare and Medicaid programs, which are most of the healthcare organizations in America. Section 482.23 spells out the condition of participation for nursing services. Condition of participation requires compliance with the regulations. A couple of excerpts from this code are talking about the standard of the organization. The hospital must have a well-organized service, nursing service, with a plan of administrative authority and delineation of responsibilities for patient care. The director of the nursing service must have a licensed, must be a licensed registered nurse. He or she, of course, that tells you the dating of this. It should be they are responsible for the operation of the service, including determining the types and numbers of nursing personnel and staff necessary to provide nursing care for all areas of the hospital. Standard B is about staffing and delivery of care. The nursing service must have adequate numbers of licensed registered nurses, licensed practical nurses, and other personnel to provide nursing care to all patients as needed. There must be supervisory and staff personnel for each department or nursing unit to ensure, when needed, the immediate availability of a registered nurse for the care of any patient. Stay with me now. Another important aspect of nurse staffing affects the budget of the organization in both positive and negative ways. This article, retrieved from National Institutes of Health, states that nurse staffing constitutes a significant portion of the healthcare institution's budget. An excerpt from this article is worth reading. In this article, it appears that the benefits of attending to appropriate nurse staffing levels contributes to patient safety as well as nurse retention. Registered nurses constitute the largest group of healthcare professionals in the United States, and adequate nurse staffing has been linked to measures of both patient and nurse satisfaction and quality of care provided to patients. The relationship between nurse staffing and measures of patient outcomes, such as failure to rescue, mortality, and falls, and nurse outcomes, such as satisfaction and turnover, has received significant attention in the literature, with often similar conclusions regarding patient and nursing-related outcomes. Aiken and colleagues found that the risk-adjusted 30-day mortality and failure to rescue rates of hospital surgical patients increased by 7% for every one patient increase in nurse workload. A higher proportion of nurses was associated with lower patient mortality rates, lower rates of adverse hospital events, including pressure ulcers, urinary tract infections, and falls, as well as lower rates of other adverse patient outcomes. A meta-analysis conducted by Kane and researchers in 2007 concluded that higher RN staffing is associated with decreased risk of hospital-related mortality, hospital-acquired pneumonia, and other adverse patient outcomes. Overall, the majority of literature on nurse staffing and patient outcomes suggests that greater levels of nurses lead to overall better patient outcomes. Are you still there? Let's look at what the American Nurses Association says about nurse staffing. Our healthcare system faces immense challenges. Staff shortages brought about by cost-cutting decisions, an aging population, increased patient complexity and need, and an aging workforce places stress on working conditions for nurses and affects patient care and overall outcomes. An increasing body of evidence shows appropriate nurse staffing contributes to improved patient outcomes and greater satisfaction for both patients and staff. However, the need remains for appropriate staffing in all healthcare settings. For more than 2 decades, the ANA has continued working to address unsafe nurse staffing levels to improve working conditions for nurses and achieve optimal patient outcomes. And I might add that is without a nurse union. More on the nurse unions later. To continue, safe nurse staffing is essential to both the nursing profession and to the overall healthcare system. Staffing affects the ability of all nurses to deliver safe, quality care in all practice settings. By eliminating unsafe nurse staffing practices and policies, we can provide better health care for all. The American Nurses Association is committed to providing the best in evidence-based policy, practice products, advocacy, and professional development to ensure safe staffing and transform health and healthcare delivery. You can go to the Nursing World website, the ANA's website, to find out a lot more information. Here's a word about unions. Unions can be non-nursing or national, like the National Nurses United. RegisteredNursing.org is not a union website, but has an interesting article about unions for nursing. At this site, they have an article, Do Unions Benefit or Harm Healthcare and Nursing Industries?, in which they state there is much research, yet little definitive proof for either argument on the harm or benefit of unionizing nurses. The unsustainable wage increases and golden ticket benefit packages with some institutions are creating sinkholes of cost versus a reasonable at-market wage that allows organizations to invest more into patient care programs. One fact remains true: unions in healthcare is big business for union leaders. Under the guise of improving nursing working condition and patient outcomes, unions continue to advocate for their own survival first and foremost. It seems kind of negative. Okay, now that we have some basics aside, let's look at the nitty-gritty of how you can best respond to work in a shift that is short-staffed. First things first. Report the situation to your charge nurse, supervisor, or director of nursing, going up the chain of command. Use ISBAR communication. First, identify yourself, describe the situation, give a little background, give your assessment and recommendations. Here's an example. This is Mary, charge nurse on 4 North. We have 2 RNs and 1 care assistant with a census of 15 patients, including 3 first-day post-op patients, 2 diabetic patients being taught insulin administration today, 4 pneumonia patients, and we are scheduled to receive 4 post-op patients. 1 RN called in sick, and 1 care assistant was floated to 3 South. I think this staffing is inadequate and places the patients, the staff, and the hospital at risk. Here's my recommendation. Ideally, we need to be staffed with 3 RNs and 2 care assistants. Minimally, we need 1 more RN and 1 more care assistant. I can assist with teaching, admissions, and discharges. Another important thing to remember is to manage your own stress. These are stressful shifts. Take a deep breath and move on. Okay, use some controlled breathing. It helps you to focus. I know another thing that might help in the long run is to try some mind games like Sudoku to enhance logical thinking. It really does help. Ratchet up your listening skills. Hearing is accidental, involuntary, and effortless, I heard, but listening is truly focused, voluntary, and intentional. Let's get back to our goals. The first goal is to protect your patients. Handoff is important and deserves your full attention. Be sure to ask any questions you have if you need to clarify anything. Now is the time. Many nurses use a brain sheet to document important information on their patients. A brain should not have any specific identifying information other than room number and is best carried in a secure pocket on the nurse's person. The brain can be used as a reminder for important tasks such as medication times and diet information. Notes on assessment can be easily jotted down to document later. However, if there is a computer at the patient's bedside, it is important to document as you go in the electronic health record, so the information is available to other members of the healthcare team in a timely manner. When in a hurry, as you will be when short-staffed, the most up-to-date information on your patients can be found in the Care Provider Progress Note. usually under assessments and plan at the very bottom. Try to attend rounds if at all possible. Rounds are a great place to correct misinformation or share most current condition of a patient. What do you say to your patients as they notice that you're very busy and their call lights are taking longer to answer? Rather than screaming across the microphone, try to take a minute at some point on rounds to plan the day with your patients. It's helpful to have a dry erase board in the room to outline the activities for the day. At best, try to round every hour on each patient and let them know you will. But if you tell them you will be back at a certain time, be sure you are so that their trust is not eroded. Do not share any information about how busy you are or about any other patients or tasks that you're trying to accomplish. Mobilizing help. Think about recruiting others, family members, students, ancillary staff, and volunteers to do tasks that do not require a registered nurse. Bathing, linen changes, distraction, helping with meals, or just being present. Prioritizing care. Remember your ABCs. Airway is critical, so anyone with an airway issue needs to be rounded on first to determine their stability. What are their SATs? How much O2 are they on? How about level of consciousness? Identify a deteriorating patient as soon as possible and then mobilize help. Know the phone number for your rapid response team. Delegating care. Be sure to include the care assistants, nurse techs in on report. Or at minimum, go to the care assistant as soon as possible after handoff to communicate clear expectations about their tasks on each patient. The care assistant's job description should be clear on what tasks they can do, but be sure to give opportunity for questions, letting them know how to reach you during the shift in case questions arise. Remember that you, as the nurse, are to identify and carry out the tasks that only the RN can do, and delegate the rest. I have a quick story. I was with a student. We were drawing blood, so we drew labs from an IV site. That was pretty complicated. She did it well. The tubes were laid on the bedside after identifier labels were put on them and initialed. Then she continued to help the patient with their bath, getting linens and thinking about changing the bed. And I immediately reminded her, you can delegate that to the care assistant, but you're the only one who can take that blood and get it to the lab. So do that task. That's your job. No one else can do that. Somebody else can help with the bath or do the linen changes. Okay, moving on to our second goal, protect yourself. Whether or not a nurse needs liability insurance is controversial, and each nurse must decide that for themselves. Accidents do happen, and although they are viewed as a system problem, there can still be blame at the personal level. Be safe, utilizing all safety tools that you can. Even at our best, errors can occur. Always use the event reporting system available to you. This protects you and the organization. At the HRQ, Agency for Healthcare Research and Quality website, Carol Hemmelgarn, a patient advocate, states, "We realize that mistakes happen. We can forgive that. But you harm us again by not being honest and transparent with us. We should be healing and learning together how to prevent this from happening to someone else." Again, protect yourself with anecdotal notes. Here's a simple sheet about anecdotal notes, which are notes that you can take to remember an event that is important. Here I put down the date and time of the event, who was involved, what happened, and just a comment. You may never need these again, but it might be helpful to bring back to mind something that occurred that's really important. Self-care is important, so you can be at your best for yourself and those around you. Know your skills and your abilities. Experience couples with knowledge to climb the ladder to expert nurse. Reflect on your experiences to assimilate them into your critical thinking. And here's a great poster on relieving stress. It's more likely for chronic stress that comes with seasons of short staffing. Start with a good night's sleep. Take a bottle of water to work and drink it. Most of the time you can keep a bottle nearby off the table, but know your organization's rules. At any rate, adequate hydration can help the brain work better for better thinking and decision-making ability. Your brain sheet will function as your task or to-do items. Plan the work and work the plan. Take snacks that can be easily eaten without heating or utensils. Plan for several shorter meals rather than the traditional 2 15-minute breaks and 30-minute lunch. Practice controlled breathing. Practicing controlled breathing often allows it to become more automatic. Controlled breathing can help clarify chaos and take control of stress. You can find a narrated PowerPoint on controlled breathing on my YouTube channel, Prof. Clay A+ Clinicals. Attitude is everything. Know yourself. What pushes your buttons? What are your buttons? Try to keep a positive outlook for your own well-being as well as those around you. Nobody wants to work with a grumpy, negative person, but one who has a can-do attitude and gives high fives at the end of a trying shift. This article in the HuffPost describes 22 tiny mental health habits that can improve your life in 2022. You might find some useful information to help you turn a bad day into a tolerable or even special day. At Livestrong.com, there's a really great article on working toward balance. This says whether you're a new or experienced shift worker, you can create a healthy 12-hour shift eating plan that sets you up for success. While caffeine and sugar might give you a momentary boost, they won't sustain you over the course of a 12-hour shift. In contrast, a healthy meal plan for 12-hour shifts will give you lasting energy that fuels your long work days. Your meal plan for a 12-hour shift should include a variety of vegetables, fruits, whole grains, fat-free and low-fat dairy, a small amount of oil, and lean proteins like chicken and fish. Limit saturated and trans fats, added sugars, sodium, and alcohol. Good advice. The final goal is to protect the organization by informing, reporting, and documenting. Keep your manager informed of staffing issues and any significant events to give them a heads up. Go through your chain of command to report any great concerns. Document your actions and responses you get. Yeah, write down names. This is where anecdotal notes come in. Time and date entries, and keep the notes in a secure place as they can be discoverable in a court of law. Above all, have an attitude of working together to solve an unsafe staffing situation. Picture everyone on the same side of the table looking at the problem together. Control emotions and bring out facts that support your concerns. Use the ISBAR format for best results. In summary, remember these goals. Protect your patients, protect yourself, and protect your organization. Thanks for watching, and you can find many more narrated PowerPoints for students and nurses at my YouTube channel, Prof. Clay A+ Clinicals.